Hi, I'm Dr. Plant. Together we are going to see what it is like to experience the disease called appendicitis by following around my patient Ronnie. For Ronnie, everything began when he started to experience the feeling of a cramp near his abdomen. This is close to your belly button.
I am not feeling well. I have a cramp near my belly button and I feel like I can't use the bathroom.
Okay, Ronnie, not to worry. Take it easy for now.
5 hours later, Ronnie's cramp got much worse. Ronnie also lost his appetite and felt like he was going to throw up.
Because your symptoms have gotten worse, we are going to take you to the doctor. It is always best to see a doctor immediately if any symptoms worsen within a short period of time, especially if you are showing signs of appendicitis.
The pain is in the lower right part of my stomach, on the right side of my belly button. It is swollen and it hurts to the touch. I also have a fever.
Ronnie is a very healthy kid. She plays a lot of sports and has no previous medical history. Just yesterday, Ronnie was playing soccer. This seemed to come up suddenly.
Ronnie has appendicitis. So far, we can summarize that some symptoms for appendicitis are cramps, throwing up, swelling, loss of appetite, and a fever. We also learned that anyone can get appendicitis and that it is very serious.
Ronnie, appendicitis means that your appendix is angry or inflamed because something called stool is blocking the appendix, causing pain. Stool is a mixture of nutrients and other waste that have not been digested. The appendix is a part of your body that is connected to your large intestine. It is not very important, therefore, you can safely get it removed and live without it.
That means that I will need a surgery called an appendectomy. During this, Dr. Plant will remove my appendix and I'll be back to my normal self within weeks. If I did not get my appendix removed now that I have appendicitis, I would risk my appendix bursting. Then I would be in a lot more pain and my situation would be more severe.
Appendicitis cannot be prevented or avoided. Approximately 7% of the population gets appendicitis. Once you get it and you get your appendix removed, you can't get it again.
We are going to prepare for this surgery now. This surgery is laparoscopic. That means that you won't have a scar and the incision or the opening for the surgery will be very small. After the surgery, you are going to feel sharp pain, and it is going to be a little while until your appetite comes back. You may also feel bloated or blown up like a balloon. This is because we need to expand your stomach so that we can perform the surgery. You will get rid of this by passing gas. At this point, we can summarize that appendicitis is the inflammation of the appendix and is caused by a blockage of what is most commonly stool. We have learned that we can live our lives without our appendix and that the recovery time can be between 1 to 4 weeks. We have also learned that the surgery can be done through a tiny opening and that after the surgery you will feel sharp pain.
Am I the only mammal that has an appendix?
No, all mammals have an appendix, although in herbivores like elephants, their appendix is called the cecum. The cecum contains complex bacteria and microbes that are able to digest cellulose. Cellulose is a compound found in the leaves and the stems of plants. This means that the cecum or the appendix is very important for animals like elephants and koalas because their diet relies solely on the nutrients from plants. In humans, the appendix serves a very little purpose because cellulose is too hard for our bodies to digest. The appendix is a vestigial structure for humans, which means that over time, the appendix has become almost useless.
That's cool. Mom, can we get a pet koala?
After looking at Ronnie's case, we have learned a lot about appendicitis. We have learned the symptoms, the common cause, some terminology regarding the surgery, and more. We have also learned about the treatment and the recovery, as well as some comparative anatomy by looking at the appendix in herbivores. Hopefully, you never have to apply this new knowledge firsthand by getting appendicitis.